Hi, I'm Elizabeth Lee, and I'm happy to be talking to you today about one of the most popular operations at Artful Surgery, the removal of breast implants. We're going to touch on a bunch of different topics, and these are going to hopefully provide you with information that we'll also elaborate on when you come in for a consultation. So women present to the office with multiple different reasons for wanting their breast implants out. Sometimes there's a problem with the implant itself, where you might have evidence of rupture or deflation of saline implants. Sometimes the implants are hard and uncomfortable and can sometimes be visible from capsular contracture. Sometimes you just don't like the size or the way they look, and unfortunately, in my experience, there are a lot of women who wake up in recovery room with implants that were larger than they had wanted, and they haven't liked them from the moment they got them. And then there are people who have been happy with their implants for a period of time, and over time their bodies have changed, their lifestyles have changed, and they're just ready to move on to the next phase without the breast implants. So implants can be taken out, and there can be other operations that are done at the same time. Sometimes all we do is take out the implants and patients heal and have normal, natural looking breasts. Sometimes the scar capsule that your body makes around the implant is causing a problem and needs to come out, and that's called a capsulectomy. Occasionally women want a different size, shape, softness of implant, and we can exchange the old implants for new. And sometimes women want smaller, perkier breasts, and we can do a lift at the same time as we take out the implants. Let's go through some of my patients. This is one of my earlier patients who was young, had saline implants, wanted them out. And when she told me that, and I said, absolutely, let's take them out, she burst into tears. And when I asked her why she was crying, she said it was because she had seen 4 other surgeons before me, and every one of them had told her that she would not be happy without her implants, and therefore they were not going to take them out, that they would exchange them for smaller, but they were unwilling to discuss implant removal. And I find that incredibly unfair and unnecessary, and I don't begin to think that I know what a patient really wants. And here she is with a simple implant removal through her inframammary crease incision, and she has normal, natural, smaller breasts, and she was thrilled. Here's an older patient with long-standing silicone gel implants. She has capsular contracture, so the breasts were hard, and the implants are visible. And she had implant removal through her inframammary crease incision. And I will tell you that we are aware that this is one of the most frequently viewed photographs on our website. So I am guessing that these normal, natural looking results after implant removal are what a lot of women are looking for. Here's a younger patient who said these implants were too big for her from the beginning, and she came in to have them removed. She also had scars around her areolas and nipples, which she did not like. So we did take these out through an incision around the areola so that we could do a scar revision of the periareolar incision. And here are her post-operative results with no lift, just with the scar revision. And here's our next patient with saline breast implants over 11 years, just decided she didn't want them anymore. Taken out easily, no additional scars, and no lift. And here are her post-removal photographs. Having surgery and healing well requires good planning for your recovery. We do this operation as an outpatient at our fully accredited freestanding facilities. You come in the day of the surgery, you have your operation, you go home, and you rest in your own bed. It is really important to plan to take enough time off work, and for breast implant removal, that's usually a week from a desk-type job. And during that week, I don't want you on the internet working from home. I don't want you answering emails. I don't want you distracting yourself from anything that your body needs. So my goal is to have you binge watch TV or read. If you have children at home, you're likely to need help for that week, and I want you to plan for that. The drains usually come out sometime during that first week. And at the beginning of week 2, you can plan to go back to your desk-type job. It is really important, though, to plan for needing extra sleep in the 6 weeks after surgery. Your body heals during sleep, and so plan your surgery at a time where you are not going to find it difficult to sleep for an extra 2 hours every night. By the first day of week 7, patients really feel back to themselves, and the sleep requirement usually goes back to normal. Women, in my experience, are really nervous about having their breast implants out. They're nervous about having new scars. They're nervous about not liking their bodies. They know that they put the implants in for a reason, and they're not sure that they're going to like the way they look without them. And it's important to know that 97% of women are glad they had their implants out. Patients often have a lot of questions, and we're just going to go over a few of the most common ones. How do you know when it's time to have your implants taken out? The shortest answer is you want them out. It's time. But then, of course, there can be problems with the implants, and those are also indications to get information about having them taken out. Women are always worried about what they're going to look like without the implants. And in my experience, most women have normal, natural appearing breasts without any additional scars or lifts once the implants are taken out. And should you take out your implants and decide down the road that you really want something else back in, you haven't burned any bridges, and you can absolutely have a re-augmentation at any point in the future. Thank you for joining me. For more information about breast implant removal, please contact us at artfulsurgery.com. I look forward to meeting you. Thank you.